My name's Ben Pallant. I am a longtime Rhode Islander and a member of the class of 2022 in the MD’22 program at the medical school here at Brown. Seeing my classmates mobilize and find things to contribute during COVID-19 has been very inspiring, but also sort of unsurprising. I think medical students are incredibly capable at finding ways to contribute, even when it's not obvious what the responsibility is. And there are more examples than you can even count of ways people have done that here in Rhode Island, at the medical school, and for wherever their own home communities are over the last couple of weeks and months. Since March, my time has been spent doing a couple of things. One is more academic, preparing for the big STEP exam, which is the first part of the boards for us going into our third year of medical school. And the other has been helping out with an organization that has sprung up in response to the shortage of personal protective equipment called GetUsPPE. It was started by Dr. Rani here at Brown and a couple of other physicians to work on mobilizing volunteer efforts to help respond to some of the protective equipment shortages for frontline healthcare workers. And so my role with them has been helping to take the offers of donations and the requests for PPE and help match those together and get those supplies from point A to point B to actually start protecting healthcare workers on the front line. In terms of what we actually do day to day, it's a variety of things. Part of it is outreach, getting a sense of who has the greatest need and where we can garner donations from, whether financial donations to begin executing on our PPE or actual existing equipment that can be donated. And we also have spent a lot of our time working on improving our own systems in terms of making more efficient the ways of matching and covering the logistics for getting PPE to where it needs to go, figuring out how best to execute on our outreach so that we can assess where the greatest need is and how to meet it in the most equitable and efficient fashion. At this point, there have been at least a half dozen Brown students who have been involved in a very sustained way with the GetUsPPE effort, both undergraduate and graduate and medical students. But at various points, there have been as many as 100 volunteer grad students helping out on things like phone banking initiatives, data cleanup initiatives, and things like that. The other really exciting thing about GetUsPPE is it's drawn together students from a number of medical schools and other health professional schools from across the country. So I've been very lucky to collaborate with students from peer schools in many different states around the US and the efforts that they're working on in their local communities as well. I think the thing that drew me to start getting involved in response to the COVID-19 outbreak, and that drew a lot of medical students toward this, is sort of the innate sense that people going into medical professions feel that we want to have tangible impacts at the times where it's most obviously needed. It was so clear that a lot of difficulty was going to be happening so quickly when this COVID-19 outbreak came to the United States. And medical students saw a lot of different gaps that could very, not easily, but very immediately be met by including more person power, more dedicated time, and a sense of how medical systems work and sometimes don't work very well. I think our training has most of all allowed us to help out in the sense that a lot of the work that actually needs to be done involves helping reach out to people and to contact other people. And Brown does a really good job emphasizing, essentially from the first day of medical school, the need to interact with your patients and not just with their medical problems. And so I think we were really well suited to be doing things like reaching out to people on the telephone to let them know whether or not their COVID test came back positive, or reaching out to physicians' offices to see if they did still need masks and gowns and gloves at a time when certain physicians around the country were reporting facing retribution when they reported these shortages at their own workplaces. I think we were ready to navigate those conversations even without specific training on how to do them in a way that was most supportive of the needs at the time. I think my experiences during the COVID outbreak and being involved with GetUsPPE during that time have sort of reinforced a sense of what brought me to medicine in the first place. I'm part of the PCPM, Primary Care Population Medicine program here at Brown, which is focused on population level health responses, and in many cases, those are things that are either preventative or protective of health before there are problems. And one of the really strong reminders that we've seen in lots of ways during COVID-19, and especially with the PPE issue, has been that preparedness is much, much easier than response. And although the responses have been incredible, there are a lot of things that, on hindsight, we wish we had done or had been done earlier before any of this became such a widespread problem, or before we even knew it could be. I think that preventive medicine is something that really draws me and a lot of the other students in the primary care population medicine program to the work that we do. And this has to happen both for individuals and for community-based health, but also for more systemic responses in the public health and epidemiologic realm as well. As a student training to become a physician, I know that I and pretty much all of my classmates are eager to go back to doing the learning that we were originally scheduled and planning to do, working in the hospitals, meeting patients face-to-face, learning from physicians as they care for a wide variety of health challenges that people face here in Rhode Island. I know that what I've learned from this challenge going forward, and from seeing how my classmates have responded as well, is that there will always be something that we can contribute, no matter how complicated the moment becomes. And that the people I'm around, who I'm learning with, and who will eventually be my professional colleagues as well, are always going to jump in to do whatever is the most valuable, even if that's different than the initial job that we thought would be at hand. It's been a really clear reminder that the thing that you thought you would be doing isn't always the most important, and that we're capable of adjusting to that as the moment calls for.